Our studio guest joins us on a periodic basis. There's a rotation they have at Trip Family Medicine, so we see three people on a regular basis and sometimes a fourth. Most of you are familiar with Russell Singleton, though, because he's a very strong pinch hitter. You know, the old baseball story goes like this: that a guy named Wally Pipp, he was a big star with the New York Yankees, and then one day he had to go out of the lineup, so they looked down the dugout and they said, "All right, Gehrig, you go in." And he ended up playing 2,180 or so straight games, and Pipp never got back in the lineup. You should remind Dr. Tripp about that.
I'll take that under advisement.
Well, first of all, welcome back to the program.
Thank you. It's good to be here.
You're talking a little bit about, I don't know, maybe I don't think it's too strong a word to say this, about mixing maybe a little faith with medicine.
Yeah, a couple of weeks ago, Jeremy, the other PA in the office, talked about insurance. He brought in a broker to help him talk about some options. So I thought it would be good and fair to maybe talk about an insurance alternative. Now, I want to be careful about that terminology because what we're going to talk about today is not insurance. And so we have to be careful about calling it an alternative to insurance.
Although, when I'm in an emergency, sometimes faith isn't insurance, but
Yeah.
that's.
Well, and that's exactly where we're going today. We're talking about healthcare sharing ministries. And most of these organizations we're going to talk about today, the principles we're going to talk about today, are built around faith. They're built around biblical faith. So the patient population that they're serving may be a little bit narrow, but there are some newer ones, the ones that we'll talk about, that have a much broader philosophical statement, and so they're much more inclusive in their membership.
I know I've heard of this in a few cases because a couple of there's a number of doctors, physicians, and the like, and dentists who are serving in the House and Senate in Washington. But both Andy Harris, who's a congressman, and Rand Paul, who's a senator, they as doctors, they go on the road when they get some break times during the year, and they travel either the country or they go overseas and they do surgeries on people, for very poor people often, and it doesn't cost them anything, but they do it as part of the efforts of their church. It's an outreach.
Yeah, and that's exactly how these started. A lot of these healthcare sharing ministries started either in the 80s or in the early 90s. So this is not a new concept. The Affordable Care Act specifically grandfathered a lot of these organizations in because they had been around for decades prior to the establishment of the Affordable Care Act in 2010.
And so what happens is that somebody working in medicine just decides they've got to give a little back.
Yeah, and I would say that that type of attitude is predominant among these organizations because I think the uniting factor is that you have to believe in in sharing one another's burdens. You have to believe in taking care of your fellow man, and that's the whole principle behind sharing healthcare costs. This is not insurance. There's no contractual obligation. There's no one collecting, investing your money, purchasing reinsurance, employing actuaries, managing risk. You've got people getting healthcare, typically as a self-pay patient. They're sometimes paying up front, sometimes having the ministry negotiate the bill for them. But then you share the actual cost of medicine among like-minded people, not the contracted amount, not what the anticipated amount is, but what the actual amount is.
And so people actually are getting involved helping pay these medical costs in some cases.
Yeah, there are many opportunities to pay above and beyond what your quote unquote sharing amount is. And it is based on the fact that these types of people, people involved in these ministries, want to help. It's not just taking care of themselves, it's also trying to help others in their time of need.
I equate it to a little bit of what takes place with other causes. My niece has been off and on heavily involved over a number of years with Habitat for Humanity. And not only does she go down to some poor county in Kentucky and help with building homes, but she also works in the soup kitchens and the like. It's very similar in that type of fashion. It's just instead of building a home, you're trying to maybe rebuild someone's body and health.
And I think because of that, the administrative cost on these groups is much, much lower. We're talking probably 10% or maybe less because these are not for-profit companies. These are not companies that are paying millions of dollars to CEOs who could probably just as easily be replaced by anyone else in the company. Their goal is to defray the burden of healthcare costs among your peers, among your fellow man, and I think they do a very good job. We have had experience in the office with several of these, and hands down, it has been a good experience. We have not felt taken advantage of. We've been paid. We've been paid promptly, and like I said, we've had more than one. So there are patients even in Twin Falls that are utilizing these.
When we come back to the break, maybe we can chat a little bit about this in the sense of how people who are in need can actually get involved with it. Because I'm sure for a lot of people, they've never even heard of this.
Yeah, and that would be my number one goal, not to try and promote this above actual health insurance, but to raise awareness, to encourage to go out and look, because you're probably going to end up with quote unquote premiums that are a fraction of what you're paying for an Obamacare policy.
We've got more coming up. Want to mention, of course, too, if you have a question or comment about this topic, in the next segment of the program, the telephone number 736-0300. Physician Assistant Russell Singleton joining us in studio. Me, Bill Colley, answering the telephones. The News Radio 1310 KLIX and News Radio 1310.com. We call it Better Health with Trip Family Medicine. Russell Singleton is a physician assistant at Trip Family Medicine right here in Twin Falls. We need to point out, too, Trip Family Medicine is located on Fillmore Street, directly across from the main post office. That's on the north side of the city. And for people who'd like to get in touch with the office, how do they go about doing that?
Call us 933-4400. If you call early enough, we have a lot of same day appointments or next day appointments, depending on what the situation is. But we hope to hear from you. We're still growing and have plenty of room.
And I was going to say, the, uh, the number of patients, there's always newcomers to the area who are looking for somebody new because they're not familiar with the area. And if you left an old doctor behind in, Sacramento or wherever you came from, uh, you want someone who can actually work with you in that basic old-fashioned family medicine sense. Your office is the place to go.
Yeah, I hear that a lot, even in Twin Falls, that people are coming from previous physicians where they may or may not have been happy, or organizations where they may or may not have felt cared for. And of course, moving into the area, we have people who are looking for a family doctor, one doctor for the whole family, where everyone can be seen for pretty much everything.
You were talking about these healing ministries a few minutes ago, and I have a friend. He mentioned on Facebook just in the last couple of weeks that he dropped his Obamacare policy because the cost it had reached 1,000. I remembered this figure, $1,120 per month. Now he says, and he's probably in his 60s. He can't afford this any longer. So someone like that, or people who are sometimes between jobs and they can't afford the Cobra, this might be something that would work for them.
Absolutely. I pulled some numbers from one of the companies. The four or five that are out there that you'll probably hear of are CHS, CCM, which also goes by the name MediShare, Samaritan, Liberty, Altrua, and then there's a newer one called MCS, Medical Cost Sharing. They were not around before the 1999 cutoff to be grandfathered in, but it's my understanding that they will actually offer to pay your Obamacare penalty.
Really?
Yeah, where the other ones actually will uh, qualify you as having some type of coverage, even though they are not insurance, and you will not have to pay the penalty.
If someone listening today is in that sort of that gap, call it a gap, because that's I guess is probably the best way to describe this, and they'd like to know more, how do they go about getting more details and getting involved?
Well, I'd first start just by searching the web for healthcare sharing ministries. One of the companies that I've heard probably the most about is called Liberty Health Share. And one of the reasons I am kind of drawn to them is because their statement of belief is just that members, quote, worship a biblical God in their own way. And that's pretty much all there is to it. You also have to live by a healthy lifestyle, avoid tobacco, not drink alcohol excessively. You have to be willing, of course, to assist your fellow man. And then my favorite, you have to believe in, quote, self-directed healthcare, free from government dictates, restraints, and oversights. And if that doesn't speak to the libertarian in me, I don't know what does.
Biblical God would mean you could be Jewish or Christian then, and so it's a bit of expansive in that sense.
I would think so. Some of these tend to be more restrictive, more focused towards Christians who may consider themselves evangelical, for example.
Definitions may change, right, between the different
Yeah,
organizations.
absolutely. And you should look through their requirements, look through their statements of belief, and see if are comfortable with that. Because this one talks about just a biblical God, however you want to interpret that. There are others. I think it might be Samaritan, but you have to believe, for example, that the Bible is completely infallible and that you believe in the Trinity just how it is, and you may or may not be comfortable with that. But Liberty, for example, is a little bit more inclusive. Altrua is a little bit less, excuse me, less religious, more inclusive. But absolutely know what you're getting into because you should be comfortable and you should uh, be prepared to really become a part of this and help others in a way that insurance companies just don't do.
I would imagine, though, too, that if you're of another faith, if you're Hindu or Muslim, and probably those faiths themselves have set up similar type of programs.
Well, that's an interesting point, and I can't really say that I've found any programs that are really targeted towards them. This does appear to be a predominantly Christian sort of program, and uh, if you can trace your roots back to basic Christian beliefs, or if you can, in the case of liberty, if you can agree with the fact that healthcare should be self-directed and that the government shouldn't interfere with your healthcare, then you'd probably be a good candidate for a company like Liberty.
Hmm. I wanted to point out, and I don't mean to belittle anyone here, and actually it's a compliment, but all of my Hindu friends from college, they don't have a lot of health worries because most of them became medical professionals anyway. So they they look out for themselves. They eat right, they exercise, they do all of those
Well,
things.
it's interesting you should bring that up because I think you'd be surprised knowing how many doctors don't have health insurance for these same reasons. If you have a large family, you're a practitioner in your 30s or 40s, you're now deemed an enormous health risk. You can't get a catastrophic policy anymore because you're too old, and you're paying $1,000+ a month under the Affordable Care Act. And whether you make a lot of money or not, that's that's just outrageous. It's doubled in some places, in some states. I think Arizona was hit the hardest. They were I want to say their premiums went up by over 100%.
We we will see some obvious changes coming, without having to get into any political discussion here. But we're going to see some obvious changes coming. It shouldn't harm any of these ministries, though.
No, I wouldn't think so. They've been around for 20, 30 years, and I think they're well established. They serve from what I can find, they serve about 400,000 Americans. They altogether shared hundreds of millions of dollars, I think 300 plus millions of dollars. They're not a small, insignificant player, and I don't think they're going anywhere. If it was less uh, than effective, I don't think you'd see companies in existence since 1981 or 1993 or 1994 when a lot of these were established.
10 minutes right now from 9 o'clock, and if you've got a comment or question about the topic of discussion today, and that's these health ministries, give us a call at 736-0300. That's 736-0300. We're at 21. Might get up to 23 today or 24, depending on where you live. Russell Singleton is in studio with us from Trip Family Medicine, along with Bill Cully. And we got to point out, too, that there was a time when hospitals were all, and most physicians working in hospitals all had some sort of connection to churches, because even today, when you turn on the television, I'll be watching Fox sometimes in the afternoon, and I'll see Shriners, and I'll see St. Jude, and I'll
St.
see,
Luke's,
yeah,
St. Al's, yeah,
yeah.
absolutely. Yeah, and that I think we've gone pretty far from that. It's probably up to the individual to decide whether or not healthcare is a right or healthcare is a business. But costs are going up, and I honestly believe insurance companies are partly to blame for that. Anytime a consumer is taken out of the equation and you try and have a third party and sometimes a fourth party, the government, uh, take care of these financial transactions, you lose control.
I have had friends who they didn't carry health insurance, but they paid for their basic medical care out of their own pockets. And they used to tell me that it was actually cheaper than working with an insurance company. Uh, with these health ministries, do you get the same benefit?
That is a core uh, tenet of these healthcare sharing ministries that you are, for all intents and purposes, a self-pay patient, and that you should try and negotiate the best possible cost. Some of these companies will negotiate on your behalf. Other companies will simply mail you a check after you mail them the receipt from what you've already paid, and then you can reimburse yourself or then pay your healthcare provider. So there's a lot of variety. Not all these companies do things the same way. Some companies have cards, much like an insurance card, that you can present to your provider, and like I said, they'll negotiate the best price for you. Others don't have any kind of identification. They actually encourage you to identify yourself as a self-pay patient and try and get the best deal possible. So there's some variety, but there is that core tenet that you're responsible for your healthcare, and that a group of like-minded people will help you cover the cost.
I know this is sort of a subjective answer I'm looking for, but do medical professionals themselves enjoy working with these organizations? I mean, is it worthwhile?
Our billing specialist told me that she has had nothing but good experiences with several of these companies, and I think she's even looking into it for herself. I'm looking into it for myself. I have a lot of colleagues, like I said, who don't have insurance because it is simply too expensive. And I think all of them, if not most of them, have looked into this. And I should probably add too, where we've talked about the fact that this is not insurance, there's no contractual obligation to pay, but because they're faith-based organizations, there's some exclusions that you might not see in insurance companies. For example, they're not going to pay for anything that has to do with extramarital sex. They're not going to pay for anything related to suicide. They're not going to pay for anything like gender reassignment or anything that falls outside of their belief system.
So, someone who came in with a social disease, I mean, obviously, these are things that that they would not approve of. They're not going to condone that, obviously, and for that reason, not going to cover it.
Yeah, it is. It's a difficult decision, and I think that is what gives me pause. Is that number one, there's no contractual agreement. Number two, they're the things they pay for and don't pay for are subject to the beliefs of that organization. So
Sure.
so again, when you're looking through these different companies, you need to find one that represents your beliefs so that you don't find yourself on the other side of that of that line.
From the perspective of things that are covered, obviously that gives us a little bit of detail. But we talked a little bit about catastrophic care. Are there tiers that they cover too, as well?
Yeah, for example, I can tell you a little bit about Liberty. Not that I would endorse them specifically, but they have an excellent setup. An individual has a deductible, or what they call an unshared amount, of $500 for the individual, 1,000 for a couple, 1,500 for a family, for all their plans. I mean, it's just that simple. 500, 1,000, 1,500. And then their most comprehensive plan pays for 100% of everything, up to $1 million per incident after that. The next most comprehensive plan is 100%, but only up to 125,000 per incident. Their third tier plan, their final plan, is only 70% of all costs up to $125,000 per incident. But for that most comprehensive plan, the most expensive version would be for a family led by an adult over age 65. You're looking at paying $499. And on the other end of the spectrum, a young single individual less than age 30 is paying about $100 for the cheapest plan. That is still leaps and bounds ahead of any current insurance offering um, in the traditional market.
Any restrictions for people who may have some a long-term illness that's going to require a great deal of treatment, or
Very good question. Very good question. Liberty, for example, has what they call the health track, where if you have a chronic condition like diabetes, heart disease, hypertension, they charge an extra $80 per month to basically put you with a coach and put you through a specific program to try and improve your health to the point where you can graduate out of that program and not pay that extra $80. Some of these companies have varying policies on pre-existing conditions. So if you have, I don't know, if you have heart disease and you've already had a stent placement or you've had a heart transplant, then you might want to look a little bit deeper into their policies and procedures because certain pre-existing conditions may be not covered at all, may be covered only after the first year, may be covered only partially during the first year, and every company is different.
Before we wrap up today, we've got just under a minute. We should probably mention the contact information again because sometimes people too, I'm told, if they're in a particular spot, they can't call up and ask a detailed question, but maybe they can call the office after the program.
Yeah, you could call 933-4400 and speak with Ashley, our billing specialist. You could speak with Trisha, our office manager, or basically any of our wonderful front desk staff. We are happy to accept most, if not all, insurances, including healthcare sharing ministries, in addition to self-pay patients. And I'm proud of the fact that we offer what I think is a decent deal to people who don't have insurance or any other sort of program and who just want to pay themselves.
Want to say thank you for coming by today, Russell, and we might see you next week, although it depends on where the rotation ends up spinning.
I think you'll probably be blessed with Dr. Tripp's presence, but we'll have to see about that.
All right, I want to thank Russell Singleton from Tripp Family Medicine for dropping in today. And remember, life's too short not to feel good. And of course, once again, located on Vilmore Street, directly across from the main post office in Twin Falls. The news is coming up next from Fox at 9 o'clock, right here on News Radio 1310 KLIX and NewsRadio1310.com.